When someone is cycling, the main muscles that are used to create the pedaling action are the quadriceps and hamstrings in the upper leg, and the gastrocnemius and the soleus in the calf. When starting at the 12 to 3 o'clock position, the hip extensor is used. The muscles used in this action are the gluteus maximus, semitendinosus, semimembranosus, biceps femoris, and the adductor magnus. The semitendinosus, semimembranosus, and biceps femoris are a part of the hamstring. From 3 to 6 o'clock, the knee extensor is used. This used the quadriceps femoris, which is the front thigh. 5 to 6 o'clock, ankle plantar flexor is used. The muscles used in this action are the gastrocnemius and soleus, also known as the calf, plantaris tibia posterior, flexor hallucis posterior, and the flexor digitorum longus, which are all muscles in the foot. 6 to 7 o'clock, ankle dorsiflexors are used. The muscles used in this action are tibialis anterior, also known as the shins, extension digitorum longus, and the hallucis longus, which are part of the foot, and the peroneus tetraeus, near the ankle. 7 to 9 o'clock, hip flexors are used. Muscles used in this action are the ellipsois, hip, tensor fasciae latae, hip, rectus femoris, quads, sartorius, adductor longus, inner thigh, adductor brevis, inner thigh, and pectineus, upper thigh. 9 to 12 o'clock, knee flexor. Muscles used in this action are the hamstrings or the rear thigh, gracilis, inner thigh or hip abductor, sartorius, inner thigh, popliteus, on the back of the knee, and the gastrocnemius, the calf. The pedaling motion can be broken down in a way to see the movements that are used. From 12 to 3 o'clock, a superior, high position, movement is used. 3 to 6 o'clock, anterior, nearest to the front. 6 to 9, inferior, lowest position. And 9 to 12 o'clock, posterior, nearest to the hind end. This movement also has proximal and distal elements involved. From 12 o'clock, proximal, nearest to the center of the body, and 6 o'clock distal, away from the center of the body. During cycling, all the movements usually work in sagittal plane. This is the plane of the body that runs vertically down and is perpendicular to the median plane. The median plane splits the body into left and right halves. Also, the horizontal plane divides the body into upper and lower regions. The action of pedaling occurs mostly in the lower region. Levers are everywhere in the body. In cycling, our legs are using levers when we pedal. When we lift our upper leg in the adduction movement, we use a third-class lever. The effort is where the muscle in the hip attaches to the upper leg, from the ball and socket joint of the hip to the femur. The load is the rest of the lower leg, and the fulcrum is the hip. When the knee extends outwards in the abduction movement, a third-class lever is used. The quadricep joins to the bone just below the kneecap and makes the effort point. The fulcrum is the knee and the load is the lower leg. When the calf raises so we are on our toes, we use a second-class lever. The ball of the foot is the fulcrum. The gastrocnemius joins the bone at the Achilles tendon, which makes the effort, and the load is the rest of the body. The physics of the pedaling motion involving velocity is as follows. At the 12 o'clock position there is no vertical velocity. As the rider pushes down on the pedal to the 3 o'clock position, there is no horizontal velocity. When it leaves this point and reaches the 6 o'clock position, it has no vertical velocity. As it goes back up to the 9 o'clock position, it has no horizontal velocity. The point of acceleration in pedaling is when the cyclist pushes down on the pedal to start the action. When a bike is fitted properly, the maximum angle between the hip and the ankle should be between 140 degrees and 150 degrees. These angles can change due to hamstring flexibility. The more flexible, the larger the angle. If the seat is too high, this angle increases to a point where the cyclist ends up using their toes for the final push on the pedals. This can cause knee pain and pain to the Achilles tendon if the movement is done for too long. If the seat is too low, the angle decreases to a point where it becomes too uncomfortable to pedal. This can cause pain on the quadriceps and the knees. The professional cyclist has an angle of 146.5. The minimum angle should be no less than 70 degrees. If this angle is less than 70 degrees, it can cause discomfort to the lower back and hips. If the technique isn't improved, it can lead to injury of these areas. The professional cyclist has an angle of 72.8 degrees. From comparing our cyclist to the professional, we can see that our cyclist needs to lower the seat to improve his technique. The torso angle can heavily rely on the cyclist's comfort range. To be more aerodynamic, a smaller angle can be used. For example, an angle between 30 to 40 degrees is the best for this action, but you have to be flexible in your lower back to make sure no injuries occur. A more relaxed torso will take the pressure off the lower back, hamstrings and neck and is more suitable to prevent injury. This angle is between 40 to 50 degrees. The professional cyclist has an angle of 43.5 degrees. From comparing our cyclist to the professional, we can see that our cyclist needs to move the handlebars closer to improve his technique. The minimum hip angle can be determined again by the cyclist's comfort zone. The smaller the angle, the more aerodynamic, but again, the more discomfort and risk of injury. The average hip angle is between 45 to 50 degrees. The professional cyclist has an angle of 38.2 degrees. From comparing our cyclist to the professional, we can see that the cyclist needs to move his seat back to improve his technique. Techniques can be improved by adjusting your bike to fit these angles. This means you can prevent injury and be more comfortable when you ride. Some common injuries in cycling when overuse occurs are patellofemoral pain syndrome and chondromalacia. Patellofemoral pain syndrome is sometimes called runner's knee. It is when there's pain around the kneecap. It gets worse if the knee is used more often. The only cure is rest and non-impact sports such as swimming. Chondromalacia is when there is damage or softening of the articular cartilage of the underside of the kneecap. To cure this, low-impact sports such as swimming and stationary cycling can help. If it continues, surgery can be used to smooth out the cartilage.